HHS says 41% of staff face furlough if the government shuts down. Tonight, the Department of Health and Human Services released its shutdown blueprint. Roughly 41% of HHS staff, about 32,000 plus people, would be furloughed. Inside that headline, the CDC would furlough close to two-thirds of its workforce, in the NIH around three-quarters, while entitlement operations like Medicare and Medicaid continue. We're going beyond the numbers to what that means in clinics, labs, and inboxes across the country. Every few years, agencies dust off their contingency plans, who is accepted because they protect life and property, who can telework to maintain critical systems, who must stop work. For HHS, that means frontline benefits keep moving, but the connective tissue of public health, guidance, surveillance, communications, thins out quickly. What changes first if HHS throttles back? The reporter asked inquiringly. Information flow. If CDC bulletins slow, our infection control teams get stale data. It's not panic, it's uncertainty that creeps into decisions, the administrator replied, with concern in their voice. How does a furlough hit your lab? The reporter asked inquiringly. We can keep critical animals and long-running trials stable, but we freeze new enrollments and can't process paperwork. A week off becomes a month lost when protocols stack up, the researcher replied, frustrated. Medicare and Medicaid claims continue, but customer support may slow. Some audits and program integrity work pause. The FDA's high-risk recalls and frontline food and drug safety work continue, though lower-risk inspections and guidance slow. Outbreak response by the CDC remains on, but routine surveillance, hotline support, and communications degrade. NIH patient care for those already on protocols continues, while new grant actions and peer review cycles slip. Public health isn't just emergency sirens. It's a constant background hum of surveillance, alerts, education, and coordination. When you dim that sound, small problems grow taller before anyone notices. Where is the squeeze? The reporter asked inquiringly. The director replied, concerned. Technical assistance. We rely on HHS teams for clarifications on funding, coding, and best practices. During a lapse, emails bounce and decisions slow. Community clinics face longer waits for approvals on routine program questions. Staff spend precious hours chasing guidance. Universities pause certain draws on grant funds, delaying student stipends or lab purchases. Nonprofits delivering services under HHS grants may front costs longer, tightening cash flow. Are drug supply and safety at risk? The reporter asked inquiringly. The pharmacist replied cautiously.